Hello, hello.
So much to talk about.
Yes, what a period.
What a
You know,
yeah.
these days. This painting behind me used to hang in my grandparents' house, and as a kid, I thought this was like the style to try and imitate. And then my mother took it. I'm in her house now, and for the last 2 months, I've been sitting on the same chair with the same picture behind me. I don't think I've ever looked at anything, well, including myself, for such a long time.
Yeah. Well, I know that style has actually been reflected in the different pieces that you've collected, the different mobiles,
Mobiles, yeah.
mobiles, and I've seen other art that's those bright primary colors, abstract, modernist. So
Yeah,
it's your grandparents had an influence.
absolutely. My grandfather, who would have had his 103 birthday yesterday, 103rd birthday. He was also. I was reflecting on it on his birthday. He was a civil servant, but was actually very much against classical economics. So he was an economist, trained in London Business School. London School of Economics. London School of Economics, and he worked for the UN and worked for the Israeli Tax Authority, but was always worried that economics was leaving too much out. So maybe that's another influence.
How did you how did you know? Was this through conversations? Did you come across some old letters? Did you look at some of his work?
So, so I used to spend a lot of time with him. I used to go to his office and work with him. And we got to talk a lot, and they also used to take us on vacation, just the grandparents and us kids. And then he didn't do his PhD until he was in his 60s. And his PhD was kind of a mix of philosophy and economics. And we had for a young kid, we would have discussions about taxes when he was in charge of the income of the state. It was really interesting. But yes, I think he did have a large influence. Actually, it's really interesting when sometimes we have these big steps and we say, oh, this is the influence of that person. But often it's a lot of little things that we don't really notice, where they are maybe just with retrospective view, we can say, oh, there's been lots of change in this direction, maybe it's coming from.
Yeah, I think that's one of the things that's interesting about being a parent, is seeing how similar my daughter is to me or to her father in her interest in the world and the things that she intentionally rejects. And it's fascinating seeing that development happen, and in terms of the nature-nurture debate, the influence that we have on nature is so significant.
Yeah. So, do you think that your willingness to get your daughter to rebel and accepting it so warmly and lovingly could be connected to the fact that you see yourself in her? So you say, I would have liked to behave like this. How could I prevent her from doing this? Like, if you're the same person.
Yeah, there's definitely a feedback loop that works both ways there. As someone who's open-minded and believes in that independence and not being a fan of authority or heeding authority for authority's sake, I've definitely cultivated that in her, which sometimes makes it's very much taken away my ability to use that as a mechanism for compliance, because she's like, you've always told me not to just heed to, I need a good reason. So is that me, justifying? It's like, that's what I wanted her to say. Yeah, there's some pride in there. And I tell her, I'm proud of you. Like, that's a good reaction. You're right. I didn't give you a substantial reason why that's not a good course of action.
Yep.
Yeah. So teenagers and COVID-19 is a little hard.
Yeah.
So she thinks I'm overreacting a bit, and is always pushing the limits on the rules. And she's trying to comply with them, but she uses social norms very much, much more even when I try to compel her with, the statistics or what the policy guidelines are. She says, but when I go out, very few people are wearing a mask. Why should I? Or, I understand if I'm in a store and it's crowded, then yes, but otherwise I don't see why I should. And it's difficult because teenagers are sometimes just very difficult to reason with.
Yes. But also, there's lots of arbitrariness in these decisions. And I was involved to some degree in the decisions of the Israeli government about COVID-19 and what instructions to give people. And, partially one of their realization was that, or at least the assumptions, was that if you gave different instructions to different age groups or different instructions to different areas in the country, which, the city is not the same as a village, it would seem more arbitrary than if you said, here are the rules. And the truth is we don't know because we've never had such a case like this before. But some of the theories were that people would not necessarily understand the transmission mechanism, and therefore having flexible rules for in some cases versus not others might further erode the trust of the government. So rather than doing the right thing, you do the easy thing that looks like there's no arbitrariness, even though it's more arbitrary.
Yeah, that seemingly arbitrary is very complex because the science is always evolving, and the consensus around the science takes time, and then there's the public policy implications of that science. And so this issue of the masks was very complicated, and I think it harmed a lot of the public health philosophy and ultimately the authority. And people, right, at this moment are debating the merits of masks, or even just trying to understand under what circumstances am I supposed to wear it and for what level of efficacy.
Yeah. And part of it, I think, is the communication of science as without the complexity and without the uncertainty. So, statements like masks don't work or masks are crucial don't really help. And when we ask people, like, what do you think is the percentage, what is the chance that if you stand next to somebody who is infected, that for 15 minutes, what's the chance you'll get it? Kind of probabilistic reasoning is just not part of the story. And the complex mechanism is not part of the story. And I think part of it is that the media is so short with explanations and headlines. And so rather than saying the debate should never be masks help and don't help, it should be by how much they reduce the chance of either spreading it or getting it. But if we started by the probability change, but if we said yes and no, that seems like a much bigger transition. And we're also not very good in expressing uncertainty. Like, we often don't say early days, we're not so sure, but here's our best estimate currently. That's really what we need to say. But I think also with good intentions, the scientists are not thinking multiple steps ahead. They're not saying, what happens when I would revise my opinion? They're saying, what's the chances if I say something now, people would listen and take it into heart? Because I want them to right now.
Yeah, and people very much struggle with this fundamental characteristic of science. We're so used to wanting nice, tidy truth, as opposed to this humility, this uncertainty, this, best approximation of what we know to be true. I mean, what kind of nonsense is that?
Yeah.
So it makes it very difficult for public health to be scientific in a way that provides people with often the strong guidance and the level of certainty that they need to know how to do a weird one or do another one.
Yeah, and another thing that happens with COVID is that there were some small events that had a big impact. Like the soccer game between Spain and Italy had a big impact. The choir music group in Washington State had a big impact. There was a wedding in Argentina, and those things make the numbers look very, very different in the story. Because with a pandemic, you can have small effects early on that make a big difference in how things develop. And that's incredibly confusing. Like even in Israel, should we compare ourselves to Italy? Should we compare ourselves to Jordan? What's the right comparison? We don't know. Right? What is the alternative? What would have happened if we didn't take these measures? And the US too. I mean, different states are doing very different things, but you don't know which one to compare to because they're doing so many things differently. And places with high density of public transportation, like New York City, London, very different story. Places like LA with no public transportation virtually, very different story again. So, the mechanism and the nuances of, random events like a soccer game and non-virus friendly infrastructures like public transport, all of those things have great contributions, but they're not part of our mental model of how a virus is transmitted.
So far we've talked about the ambiguity and the challenge of uncertainty in helping us to understand the appropriate course of action. We've talked about the complexity of relativism. In absence of something nice, tidy, and easy to compare, we're lost. We've talked about individual events being heightened in terms of their salience relative to maybe a broader perspective of things, all kind of adding to the overall confusion. Another one I would suggest would be counterfactual thinking. So for instance, people are saying, look at the hospitals, they're not overrun. Look at California, it was supposed to be horrible, they're not overrun. We've overreacted, and people aren't understanding the cause-effect relationship between, because actions were taken early, and so the cases were mitigated. But we have the models that showed these scenarios that show us what the potential could have been, and that's a real struggle for people.
Yeah, and I also think it's a struggle for the science. So I looked a little bit about the predictions of models, and I don't know what it is, but pandemics don't seem to follow the models. And I don't think anybody understands why. But R0 seemed to change empirically, not in the models, but R0 seemed to change as the life cycle of the virus. And some speculations are that it's herd immunity, that it's time, that it's mutation, non-symptomatic people. We don't know what it is, but if you look at the history of pandemics, you will see that the R0 seem to change. They don't react in the way that the models react, but we don't have a good biological model for that. So in the model, R0 stays the same, aside from human intervention, like social distancing or mask and so on, but it doesn't inherently change the actual level of infectious of the virus. And the models, I think, also have something very powerful, which is they have an image of how many people would get infected. And that catches a lot of attention, and therefore creates lots of fear, also memory, and therefore when it's wrong, has a lot of price. And these models also are so dependent on initial assumptions, right? When you have an exponential model, you make slightly different assumptions up front, things change dramatically.
I think it's very interesting that people judge epidemiologists very, very viciously for, the reliability or the accuracy of the prediction matching the reality, and yet there's so many other areas in life where predictions would be very useful as a mechanism to evaluate the caliber of an expert. So, and to hold experts, first of all, please make a prediction, document that prediction, declare your assumptions so that we can go back and review your thinking and potentially make your model stronger in the future. And we should be doing that with our financial advisors, our other leaders, across the board.
The people who write horoscopes.
So when we think about some of the challenges that we have, and some of the good practices, maybe this is kind of an obscure one, but we're holding the epidemiologists to account for what should just merely be a model under the scenario. We're just like, if we did nothing, this is how awful it would look. Or on the basis of these assumptions, this is how awful it would look. It's only meant to be a model. Or these are the predictions on the basis of these. But this.
So let me. Can I say two things?
Please.
Two things about this.
Please.
One is that when I just came to Israel to start working on this, I talked to every epidemiologist who would talk to me, and what I realized is, this is their area, and they are designed to think about the risk. And they were also afraid of things that were not in their model. So I can't tell you about how many people told me, but yes, what if there would be a terrible mutation? And in modeling, there's lots of freedom and of choice. And I suspect that they were extra cautious and worried. Right? All of a sudden, it was their goal, their role, to give us a prediction. And they had all of these stories in their mind, and they felt that they need to protect it. And I think, we can't do this experiment, but I think they were overly pessimistic. Like the people I talked to that says, don't dare to open anything. The virus could mutate. And that would create maybe something horrific later. And I said, what the chances? And they have a probability, but it's not in their model. But they have underlying fears that were in that. So I think they were afraid. It's their business to be afraid, right? They're probably trained to be afraid of those things. And so that's one point. The second point is, which I think they didn't take into account, is that once politicians make a decision, it's very hard to reverse it. So imagine as a politician, you decide to quarantine country. And 2 weeks later, you discovered, well, maybe it was too harsh. If you ease up, the number of sick people would go up. Actually, even if you don't ease up, the number of sick people would always go up. The cumulative number of people would always go up, and the cumulative number of people dying would always go up. But if you do a quarantine and then you ease up, odds are the number would increase in faster rate than before. It's part of the cost benefit. But now you would not be the one who is saving people. You will be the one who is killing people, right? So when you announce a harsh quarantine, you're the saver. And when you ease up the quarantine, if more people would die, even let's say that it's a trade-off between money and life, and it's worth for society, you'll be blamed. So I think the model did not take the decision maker that will adjust. In their models, you do something harsh, it's an insurance policy, and then if you find out it is not that harsh, you can always ease off, right? So you say, like in the signal detection theory, you say, what's the harm of shutting too harshly? Well, loss of the economy for 2 weeks. What are the risk of being too liberal, that the pandemic would spread? Let's be too harsh. But the model assumed a decision maker who can adjust over time with new data. But for politicians, there's a very big asymmetry about locking and opening. And by the way, for a politician, think about you get to shut down a country. What power trip this is. And then you get to give people money. It's, the next generation will pay off. So I think it plays out to a lot of power dynamics of government. Anyway, I was interrupting you.
No, that's fine. I'm just building out these differences and similarities between what we know about scientific thinking and the biases in decision making and policy making and compliance with policy that we face. So some of these challenges exist with everyday people as well. So it's very difficult to one day be told to quarantine and then the next day told that it's okay, and then the day or the week or the month after that, which we're seeing now, we've got 5 countries that have moved back into lockdown. And it's been 72 hours, I think, since several of those countries have reinstituted those lockdowns. And I wonder how those people are feeling right now.
Yeah. Must be further deterioration of trust in the government, and especially I think the communication has been very problematic. So communication needs to take into account a sense of control and helplessness, and when it doesn't, it's just terrible. So not knowing. Like we have tremendous resilience, but for resilience we need to know what's going on. Yeah. But if people say, "Stay tuned, I'll keep you posted about what's going on," you can't make plans. So do you have any summer plans? I know you used to go to Burning Man. This year is canceled.
This year's canceled. I don't have summer plans other than vacation, and there's no indication for Ontario that our plans will change. So it's going to be things like hiking in the parks and things like that here.
Yeah. So think about what it means. Like I think it's much easier to have change in plans rather than have no plans at all. Right. So the stress of not knowing what to do, and it's understandable. And of course, when you communicate it, you have to tell people, here's the current plan. Unless there's going to be X, Y, or Z, we're not going to make changes. So you can communicate lack of certainty. but without plans, very hard to live, very hard to.
It's an interesting point, because that's actually the thing that I've thought that the province of Ontario has actually done a reasonably good job with. So the premier here made it clear pretty early on, when we were still over 600 new cases per day, that in order to move into a phase 1, we would need to have a sustained period of 2 to 4 weeks of fewer than 200 new cases per day, with 90% of those traceable within 24 hours, meaning that they're not unknown or not community transmission, or it also means that we have the infrastructure in place in order to actually do proper contact tracing. And also that we have our shelters for our disadvantaged communities, such as women's shelters, and then as well as our homeless shelters and other facilities with people who are dependent on support, but there is infrastructure in place to do testing. So now it seems complex, but it's pretty straightforward. So you've got basically you've got testing mechanisms in place, you've got tracing mechanisms in place, you've got compliance tools in place, and
amount of new cases.
Amounts. And so for me, I felt that was actually a very successful way to communicate.
That's a very nice. And how far away are you from that?
We're below 400 cases a day, getting closer to 300 cases a day. And what's complicated is we are moving already into some of the phase 1 release. So, but it's also coming, each of these announcements, like dog parks are open, retail stores with street fronts that can maintain, a small number of people in the store. The rules are fairly clear, but you have to spend a lot of time keeping track. But other than that, the rules are fairly clear, but they're always being delivered with the message of, but we're going to have to see, and if there's a significant spike, we're going to have to roll back. So I think that what for me was so useful was those very specific numbers, the publication of the data on a very timely basis, the accessibility of that data, so you can see the curve declining, you see the number of new cases. It makes you feel that sense of control, that we're all in this together and we know what we need to achieve. And the rules make sense in accordance with this very specific outcome, reducing the number of new cases.
Yeah, that's great.
Yeah. So there's so much to do. How about the United States?
Where do we start? So the US has invented an unbelievable cure. It turns out if we only drink Ajax, if everybody drank Ajax, some disinfectant, the illness would go away. The US, I think, part of it is that you can have the Swedish approach, you can have the Chinese approach, the quarantine approach. They're very different, and each of them has cost and benefit, and at some point we'll argue what's the right one for which country. But what is clear is that there's no middle option. If you quarantine half the people and not quarantine the other half, that just doesn't work. You need, and the US is basically taking the everybody choose, like quarantine is a public goods problem. People who are quarantining themselves are taking a loss for the safety of everybody. And if some people don't, that's one big issue that the US can't decide which strategy they're playing, but there's no room for mixed strategy here. And then the other thing is the US has no social safety net. So imagine a person who's a daily worker delivering food. And that person is waking up one day with fever and coughing. And they should quarantine themselves. But that person doesn't have money to eat for 2 weeks for themselves or for their family. And now they have a choice. What do they do? Do they quarantine themselves for the good of the nation? Or do they continue working? You know, in Israel, we started tracking the history of people who became identified as carriers very early on. And they would publish their path in the beginning in social media, and not social media, in the news, but then through an app. And those people were like, you look at them and say, who are these people? Like, you know, I go to work and come back. Maybe I stop at a supermarket, maybe I go for a walk. Those people, the first patients in Corona, like they were visiting 80 places a day. And you looked at it, you said, who are those people? Well, it turns out if you go to 80 places a day, you have a higher chance of being infected. So we have these super spreaders. And the super spreaders are basically more likely to get infected and more likely to infect other people. It's not as if the moment they get infected, they start walking around and visiting more people. They always did that. That's why they have a higher risk and so on. And in general, these are low income, low social economic status individuals, right? They don't have a big office. They sit it all day. They do other things, statistically. So a country like the US, with no real camaraderie and no social network, is a place where the super spreaders are the least likely to quarantine themselves.
Yeah, I think we're in a period now where we will see more cases amongst the either active protesters or the passively defiant. I think we have a church now in Texas where the pastor has died. 19. He's not the first. There have been other pastors that have died. The thing about this one that's sad is that they had actually implemented what they thought were reasonable social distancing protocols within the church. So they had a very restricted number of people that were able to come in and participate in the service. And on top of that, they had a distance between each of the individuals, and yet that was inadequate. And so several of the other parishioners are actually ill now.
Wow. Somebody said, it was very nasty comment, but somebody said that if this virus was just more deadly, all the anti-vaxxers would be gone.
Yeah, well, we'll see if we're going to be lucky enough to have a vaccine to be able to have that twisted joy.
It's actually, you know, you said something about science. I think both of you and I, on one hand, there's, you know, news keep on changing and it's very tough for science. On the other hand, we're both in awe of how science is going. Collaboration, help, speed, and I think actually that those stories, as well as the importance of vaccinations, it's a really amazing opportunity for that, right? Instead of just looking at the mistaken estimations, or, you know, not mistakes, but, you know, initial assumptions and so on. I think it's one of science's most beautiful hours, because people are really coming together and lots of things are happening very, very fast. Lots of effort, all kinds of really creative approaches, mechanisms, and so on. I think that story is not enough in the front. Like the politicians are making decisions about, what to close and what to open, but the real advances is going to come from science, and that story. I wish it was more central. I wish the reporting was not just about. I mean, you can read those things, but it's not the front page of the process science is making. We're mostly focusing on the news is how many people died today or yesterday, rather than the heroic effort that people are making. And it's only also an opportunity to get people to change their opinions about vaccination. Like with polio, I know, because polio has not been around for such a long time, not in a big way, people stop worrying about it. And maybe now there'll be reinvigoration of interest in vaccination in general.
Yeah. Well, I'm hoping that there's an opportunity for us to really start to understand where these deep level conspiracies come from, and revisiting the role of pseudoscientific belief in society. Right now, there's just quite a bit of debate, disappointment, disgust, outrage on all sides. And it's a really important opportunity for us to learn how to improve those conversations.
Yeah. I talked to somebody today about fake news. There's so much of it. And it's so crazy. But what do you think would happen if we created a website for fake news and we said it was fake news? Would people still a little bit believe it? That's a kind of question number one. And if it looked real, will they also start doubt Fox News or something like that?
Now, didn't Facebook do an experiment on that, and that they found that the information that was flagged as, I don't know, suspect or something like that, ended up having more people believing it, because it seemed as if it was, alternative, and we all take pride, right, in being skeptical. We're taught to be skeptical of the media that we're consuming. When I was a kid, media literacy was a thing, and the generation kind of behind me, we taught media literacy, and one of the things that we were trained on was be skeptical. So I think that what Facebook found was something along the lines of, when information was flagged like that, it actually led people to be more likely to believe it.
Yeah, the thing I remember from somebody's research is that when something seems really strange and flies in the face of logic, people share it more because it feels more sure-worthy. Whereas if you find something is run of the mill and not a conspiracy theory and so on, it's not as exciting.
Yeah. So I think when we talk about the great things that are happening in science in terms of collaboration and communication, I think we're also starting to get to a point where there's some of the flaws and frustration, even within the scientific community, of maybe publishing things too soon, publishing things in a way that might be seen as more self-serving than beneficial to, adding to the knowledge. People aren't taking enough time to see what's already been researched, and are we adding to that, or are we, doing a careful job of countering it with thoughtful deliberation? What are some of your thoughts in terms of how we're doing with bioRxiv and other sites where we're, the power of the preprint?
Yeah. So I think the issue is, I don't think there's any malice, and I think everything comes from a good perspective. But there's such a sense of urgency. There's such a sense of urgency that in the hierarchy of what's important, some things go away. And I don't know what to tell you about this, because For example, do I think that drug trials should be shortened for this? Yes. Do I think we need to revisit the 1-year trial process? Maybe. And is that basically a trade-off between time needs and accuracy needs? Yes. So I think the whole community is trying to help. A little bit stressed. Every day seems like such a long time to wait. That people are taking some shortcuts. But you and I both share the perspective that science is a self-correcting mechanism. So yes, there's going to be more noise in the early days, but hopefully it would fix itself when the stress settles down.
Paul Bloom and I were talking about this, and one of the things that he was pointing out, he had read the Javan Bevel and team paper, and a couple others that just talk about how much social science research has been cranked out, and there's an issue of poor quality, and then there's also this issue of scientists sort of not staying in their lane. And I countered some of that with kind of the same optimism that you did, which is that the motivation generally is very positive, and there's this desire, everyone wants to help in the way that they can. I have a friend who sews masks, and she's got beautiful talent in that area, and I don't have that talent. But I was able to work with some other scientists, and we were very curious about what some of the drivers were for people's receptivity to believing in hoaxes. And I have the ability to look at these kinds of questions and design experiments and rally some of the resources that we need and work through that kind of design and analysis. And that's what I have to offer. So I think that we're trying to do the best we can with helping out. So what are some of the things that you've been doing? Do you feel, what papers have you, is your name going to pop up on? I know so many people want to collaborate with you all the time. How are you managing that? What have you said yes to? What are you pondering? And then actually, how are you filling your day with things that maybe aren't about research at all?
Yeah, so I actually have not done any research. I've only done applied work. And since I came to Israel, I started working on the question of how do you give messages in ways that people could listen. We looked at the distance education and tried to figure out what can work and not work in that system. We created a couple of interventions for domestic violence for women and children. We created a plan for releasing prisoners, created plans for stimulus packages, tried to get people to pre-buy from local businesses to try and give them money. We tracked people online and given them the path of people with corona. We created a national index for how adherent people were and created competition between cities. We created a very large campaign for the Orthodox Jewish community and for the Muslim community for Ramadan, the Jewish one and separately for Ramadan. And the thing is, like, none of them are experiments. And what happened is that the government is not really interested in experiments. And since I came here, I've been basically on this chair, all the time. Actually, the last 2 days have started easing off, but for the first 2 months, it was like non-stop. And and what I realize is, and you and I have this discussion a lot, is how much is our mission to study versus to apply. And in this case, every opportunity I had, I would have taken to apply what we know, but there weren't really opportunities. Like even something like the stimulus package. No time to do a randomized control trial. Everything is so big, so much in the news. There's no way to do it. What instructions do you give people? No real opportunity. Like it comes on national television, everybody gets the same version. We don't have this. So I basically helped a lot to everybody who wanted to all the time. Basically taking what we know already and saying, based on what we know, here is my best guess. But almost no research. The couple of projects that we did get going on research were about remote work. So I've been interested in remote work for a long time, partially because I wanted to reduce traffic congestion. And maybe for 2 years, I've been trying to find businesses who would get people to work from home and see how it works. And nobody wanted. Guess what? Now they're working from home. Now working from home now is not the same. You have little kids and so on. But we're doing a very large study on what is successful and not successful on work at home. So that's one opportunity. I guess the second one is the education one, what's working and not working in terms of studying kids, K to 12 studying from home. And then the only even more academic study is trying to understand the moral trade-offs that people are making between saving lives and other aspects, financial, privacy, and so on, and trying to understand basically morality through this. So, in moral psychology, we give people questions like the trolley problems, or what if. Well, now there are real questions ahead. So we were lucky enough to be able to study these problems when they're really essential for people. So I would say 95% advice, 5% academic, and I have to, it's a very different process to give advice and do applied work. And usually in a regular month, we have ups and downs. We're hopeful. We're finding something. We bureaucracy, complexity. And during COVID, I had these ups and downs 3 times a day. Right? You discover something. You talk to a politician. They decide something instead. I mean, the ups and downs, the bureaucracy, the challenges, I don't think there's evil, but lack of thinking. So it was very, very harsh. It was very harsh, both because every ugly aspect of society reveals itself in a crisis like this. And then the second thing is you realize how difficult it is to make the right choices, availability of data, all kinds of things like that.
Yes. So I have one final question for you, which is the natural experiment that's happening on our lives is letting us develop some good habits and some bad habits. How are you doing? I know your life. We've been friends for many, many years. Much travel, a say-do gap on fitness, the need to, always eat healthy foods. Those are just a few. How are you doing? And what do you hope will last? And what do you think is going to last? Let's hear a prediction.
Yeah. So I haven't been on a plane for over 2 months. Last year, I traveled 300 days a year, the last few years. That's a big difference. When I came here, the stress was so high. For the first 6 weeks, I went for 1 walk a week. The last 3 weeks are getting better. I try to go for a run a few times a week. I haven't eaten out. I don't cook real food, but I make omelets and cook something. The first 6 weeks were very stressful and very odd because I didn't see anybody. But my dream was, when this is over, I just want to go and be by myself, which sounds very strange, but I didn't want it by myself, no person. I wanted no email and no Zoom, and because I was really 7 a.m. to midnight just on calls and Zoom, and I have 2 phones and all the time, and I just wanted alone time. Like it was interesting because I didn't see anybody, but nevertheless I felt very bombarded. I think what I hope some things will change, but to make this change, I know I have to take an action, right? It's not just by itself. I was a very, very stressful period, but it certainly teaches me that the unsustainable part of what I'm doing. And I had a birthday, as you know, not too long ago, and I took that day to reflect on life, and I have a list of things that I think I need to cut off. I've been very good in adding more things, and it's just unsustainable. And this period is showing me that how unsustainable exactly. So if you ask me what will change, I think there'll be less travel, not just in this next period when there's going to be travel restrictions or something. I think as a life strategy, there'll be less travel. I think I'll carve more time that is mine to work and read. These last 2 months, I didn't do anything on my own projects. I was just on other people's timetable. So I think having a bit more selfishness or confidence to say, these are my projects and what you want is less important for me than what I want. So I think those would be the big ones. I hope that coffee consumption will go down. When I came here, I bought a new coffee machine, and they brought me coffee for a month, and I finished it in a week. And it wasn't like 1 cup a month. It was. So I hope that will change. And another good habit I got was I stopped reading the news first thing in the morning and before I go to sleep. I try to clear time in the middle of the day to read the newspaper, and not too early and not too late. I hope that will stay. That's a very waking up first thing in the morning. Why do I do it to myself? I don't know. And going to sleep, it's also terrible. So
yes. Well, those are wonderful ideas, and I hope that you're able to actually follow through on all of them now that you've made them public and you've shared them with me. I'm committing. So thank you so much. It was wonderful having a chance to just relax and talk about what we're learning, what you're seeing, what you're experiencing with the pandemic. And it's a very difficult time for all of us, but it's important to just stop and reflect and share what we're learning. So thank you so much for your time.
Thank you, and good seeing you.
Wonderful to see you. Okay.
Talk to you soon.